Hi, this is Dr. Sheena here. Today, our topic for the presentation is cast restoration. As you can see in this image, a cast restoration is any restoration that is actually built up outside the tooth and it is then inserted in the tooth structure. Right. Cast metal restoration are always complex indirect restoration. Indirect means they are fabricated outside the oral cavity. That is actually lab fabrication is done. So here we will be using cast metal alloy are used to form the entire restoration, or it may be actually structured and veneered with porcelain to create a tooth colored restoration. And this was actually introduced by Taggart where he used cast gold restorative material in 1907. Cast inlay is very important. The features of cast inlay cavity preparation is different from that of amalgam restoration. Rather than simply studying the cast inlay as such, I thought of like comparing it with amalgam so that you will come to know the important features of amalgam restoration and along with the cast inlay. First, this is actually the amalgam restoration difference, and this is cast inlay. So first of all, amalgam restoration is always a conservative cavity preparation. We'll be conservatively producing where the occlusal convergence, etc. is produced. In the case of inlay, we'll be producing it in an extensive or extensively destroyed tooth where we'll be creating an extensive cavity preparation. Since it is extensive, it is contraindicated in young tooth because in young tooth the pulp is actually more superficially placed, so it cannot be used in young patients. But in the case of amalgam, it can be used in young as well as old patient. The cost is more in cast inlay. Why? Because we'll be taking impression, we'll be actually delivering it outside the like clinic where a lab setting is required. So it is cost more. While in the case of an amalgam restoration, it is having cost less. That is mainly because it is a direct procedure which is actually completed within a single visit itself. So the bar that is used to prepare the cavity in amalgam is 245 bar. We know that with a diameter of 2.8 8 mm. And in the case of number 20, and in the case of an cast inlay, we use number 271 bar is actually used. And while we prepare amalgam restoration, we know that we will be giving a occlusal convergence. While the case of a cast inlay, we will give an occlusal slight divergence of 2 to 5 degree in per wall. That is very important. Per wall 2 to 5 degree angulation is given, while the case of amalgam, it is convergent cavity. And we in the amalgam restoration, bevels are actually not usually indicated as except the gingival bevel. We'll be giving a gingival bevel like this. If this is the cavity, we'll be giving a gingival bevel of 30 degree. Otherwise, occlusal bevel, etc. is not given in amalgam. While in the case of a cast inlay, we'll give a occlusal bevel of 30 to 40 is placed for proper adaptation of the material. Next, gingival bevel. So as I said earlier, amalgam there is gingival bevel but not the occlusal bevel. In the case of amalgam, slight difference is there. What I said, it is near to 30, that is 50 to 20 degree, while the case of a cast metal, it is 30 degree gingival bevel is given. Very important. Next is the proximal box have a inverted trunk appearance in the case of a amalgam, while in the case of a cast metal, it is almost a proper box-shaped cavity. Cavo surface angle of amalgam is 90 degree, also called as butt joint, we know. The cavo surface angle of a cast metal is 130 to 140 degree, also called as lap joint or slip joint. The marginal metal angle is also 90 degree. Since the KO surface angle is 90 degree, marginal metal angle, margin of the metal and the tooth is actually 90 degree. But here the margin metal angle is actually slightly 30 to 40 degree. You can memorize it as gingival bevel is 30, marginal is also 30, right? Flares are not indicated in an amalgam. But here we will be providing flares and bevels are actually given on the occlusal surface as well as on the proximal surface of the inlays. Now, what is the distance it is covered? In amalgam, we know that the distance of the cavity is 1/3 of the intercuspal distance. While in the case of an cast metal restoration, it is 1/4 in the case of amalgam, 1/3 in the case of a cast metal restoration. So this is the image showing the 30 to 40 degree marginal ridge, and this is actually the flares and also the bevels that is actually given. Now, what is a circumferential tie? Circumferential tie is otherwise called as a peripheral margin anatomy. Enamel must be supported by the sound dentine, and the enamel rods forms the cavo-surface margin should be continuous with sound dentine, should be covered by the restorative material. That is why we give a peripheral tie-like structure, so that the material which we place or the cast metal actually merges with the surface, and it actually rests, the enamel is supported by the sound ending. For that, we actually give the circumferential tie. The circumferential tie constitute four extra coronal restoration lines. First of all, there is chamfer preparation, knife edge or feather-like preparation, beveled shoulder preparation, and hollow preparation is there. Now, coming to the circumferential tie that is given intracoronal, this was actually given extracoronally. Extracoronal restoration are all these four. That is a chamfer preparation, knife edge preparation, beveled preparation, and hollow ground. Which is given within the cavity is like partial bevel is there. Partial bevel involve only the enamel. Short bevel, which actually involve the entire enamel is involved. Long bevel, which involve enamel and half of the dentinal wall is involved. And full bevel means which involve both the dentine as well as enamel. And in the case of a hollow ground, it is actually a concave shaped in form. Truly, actually, it is not a bevel, but sometimes given to increase the retention of the cavity. Another is actually counter bevel. In case of capping of the cusp, to protect and to support them, we will be giving a counter bevel. So, bevels are actually normally prepared, marginal bevel is prepared with the burr 28862, very important. So now for summarizing, I will be explaining the difference between amalgam, cast metal and cast ceramic. Metal, in spite of metal, we can use the ceramic also. So the width of the cavity is amalgam, we know that 1/4, here 1/3. It is 2 mm in the cast ceramic. Cavity wall is slightly convergent walls, divergence of actually 2 to 5 per wall, again divergent. Here, no convergence is degree of convergence, like value is not there. Here 2 to 5, greater than 2 to 5 in the case of cast ceramic. It will be slightly more divergent. Marginal fit, we know that 90 degree. Here it is lap or sliding joint about 130 degree. Again, cast ceramic, it is 90 degree that of amalgam. Don't forget. Bevel, slight, just a gingival bevel is given. Here occlusal and gingival bevel. Here similar to that of amalgam, no bevels is given. Cavo surface margin 90 to, we know that 90 degree is the amalgam. Here it is 140 to 150 degree is with the enamel, and metal margin is 30 to 40 degree. Cast again same as that of amalgam. Axial depth is, in the case of amalgam, it is 1.5 to 2. While in the case of cast metal, it is 1.5. Similar to that of amalgam, it is 1.5 to 2. Clearance with the nearby tooth is, for amalgam, it is most of the case 0.5. Cast metal also 0.5. Cast ceramic also 0.5. So if we study this chart, it is very easy because most of the question is asked from amalgam, cast metal and cast ceramic. Just these questions have been commonly asked. Please do revise this and make it thorough. Hope you had a wonderful section. Thank you. See you in the next class.